Thanks for staying with us. So we found a story of a man who accused a private hospital in Lagos State for alleged negligence and failure to provide adequate care, which reportedly led to the death of his wife, Loveth, and their unborn son. Joining us to shed more light on the experience of what happened is the husband of the deceased himself, Prince Tega Ovwiomodiowho. You're welcome, sir, to the show.
Thank you, man.
This is a very difficult conversation to have because
Yeah.
we've had quite a few of this in the past. You've lost your wife. My deepest condolences to you,
Thank you so
your
much.
entire family. You lost a wife and your unborn son and your son. I know you're a nurse, and part of the story we heard was that you're also there when it happened. So we'll give you the floor to tell us from start to finish what exactly happened at this hospital.
Oh, thank you so much, man. It's a privilege being here, giving me the opportunity to share my grief. But it's a very sad story, very sad story. This patient, my wife, that we're talking about, was a patient who she was a book patient of the hospital.
Okay.
So throughout the 9 months, she saw their gynecologist. The pregnancy was 100% healthy. The baby was 100% healthy. Just the day of delivery.
I have to pause you. I'm so sorry. Technical issues. Going to break. Sincere apologies. So as you were saying.
Okay. So first of all, I'm Prince Ovwiomodiowho. I'm a registered nurse anesthetist with over 10 years experience in the nursing field.
Okay.
So I'm the husband to late Mrs. Loveth and also the father to Master Jason. So my wife got pregnant sometime last year, June. So we went to this hospital, which they promised us of premium care. My wife was their book patient. So throughout the nine months period of the pregnancy, she was going every Wednesday to see the doctor. Her last ante-natal day was on the 6th of Wednesday, 2024. So everything started at 3 a.m. on Thursday. So she broke her water, what we call rupture membrane. I was at work. So she called me that, she saw water. We were so excited. We were so happy. In fact, I even wrote down in my diary that, so my son will be giving birth today, which is on the 7th. So when I closed from work, I took her to the hospital. A neighbor drove me down to the hospital. So when we got to the hospital, we told the receptionist the reason why we came, that we came for delivery.
So it's not the hospital you work, it's a different hospital.
A different hospital.
Okay. All right.
But my wife's preference.
Okay.
So they called one of the female doctor to attend to me. So the consultant wasn't around that morning. So they called her that we are around. So he gave some instructions that they should set an IV line, they should admit my wife, we should do a special scan called a biophysical profile. We did the scan was normal.
Okay.
The child's head was just at yes, where it was cephalic, what they call cephalic. So in fact the score was 8/8 to tell you how perfect the scan was. So after waiting, when we got at around 11:30, I called the doctor. My wife is in the hospital. She's not contracting. She ruptured membrane at 3 a.m. waiting to see its plan. So he told me via WhatsApp that, I'm going to induce her and I'm going to start 12 midnight. When I heard 12 midnight, I was concerned. Why midnight? So we presented at 3 a.m. We should wait till 12
The other day.
the other day. So a waiting period of over 12 hours. So I was concerned. So I told him that, I had to even explain our first baby. That, our first baby was born 2020. We went to she ruptured membrane at 9 a.m. We went to the hospital at 1 p.m. At 4 p.m. they induced her. At 11 p.m. she gave birth. Yeah. See how timely it was done. Yeah. He repeated that he's going to induce. So I called a friend who said, okay, they can induce in the night, but the practice is to do a physical one, not with a medication, because of concerns with monitoring. But even at that point, he hasn't told me the method of induction, what he planned to. So I told my wife, okay, basically, let's just wait, conserve your energy.
Yeah.
So that same Thursday at 9 p.m., I advised her, okay, why not get some rest while waiting for the induction? So all of a sudden at 11, but before now, the doctor on WhatsApp gave me 100% assurance that she will deliver safely by God's grace, that I should relax, because he saw how apprehensive I was, that I should relax, So when I also told him the history of how my first daughter, my baby was born, he said they will induce, that she will be fine.
What time did the doctor show up?
So, in fact, he showed up after 12 hours, you can imagine.
He didn't come at midnight?
He came at midnight.
Okay.
He spent just 10 minutes with us.
Okay.
He came on a scrub attire with another doctor. In fact, because we've locked the door, we've actually slept. They knocked the door, the door was locked. So when they came in, they were saying, why did we lock the door? So I apologized. So he faced me, I was like, oh, madam, how are you? Because it's the jovial type. How are you? How are you doing? Don't worry, you will deliver. Or should I just take you in for surgery? So we were blank. Okay. The conversation before now was, you are going to induce. Okay, what was the reason for the surgery? He said there was no clear indication for surgery. So we were like,
said what?
There was no clear indication. That the baby was 3.8 on the scan. Okay. And he considered big baby to be above 4. Okay. So that's how we couldn't, if him was not sure of his plan to do surgery. So we couldn't buy into it because he was not so sure. So they started their induction. So when one of the doctors came in to start the induction, that was around 10 after midnight. 10 past midnight. Yeah. So when they started, the doctor said I should excuse him. So I excused. So when I came back, my wife said they inserted some tablet, which they claim is 25 microgram. Okay. 2 hours down to an induction, she saw some trace of blood. Okay. When she went to pee. She told me immediately I was scared. I called the doctor. They just dismissed it, that it's normal with induction, that he was examine and see. So he examined her, and he said there's no bleeding anyway. So at 4 a.m., they came that she's not contracting, that they want to repeat the same medication, misoprostol. They repeated the medication. Then at 6 a.m., they said she's not contracting, but she's ripe, that her cervix is ripe for oxytocin, another form of induction. Okay. All this while the consultant was off the radar. So in the morning, they said...
The consultant who has been taking care of her before
now.
Hasn't shown up.
The only time he showed up was 10 minutes.
That's the one that came at midnight.
Yeah, midnight. He spent just 10 minutes with us. Okay. So at 6 a.m., the team decided on his behalf that they are going to start another fresh kind of induction, this time with an intravenous medication. Okay. So they said, at midnight, they were coming spirally to check her vital signs, which was normal, to check the baby's heartbeat. But there's this thing that you should strap around CTG, around the woman, so that you can constantly monitor it. They don't have it. Then there's this monitor that should be on the patient's arm, so that you can constantly monitor the blood pressure. It wasn't there. So there was poor monitoring over the night. Even that's why I objected to midnight induction. So at around 8:30, the night team handed over to the morning team. They now transferred my wife from the ward to the labor room. This is a patient I brought to the hospital myself, fully conscious, full of life. She had no comorbidity. She's not a hypertensive patient. There was no history of surgery. So when we went to the labor ward, a midwife was now in charge and a junior doctor. So they started the oxytocin induction. So my wife kept using the restroom and coming back. So I want to advise them, okay, first, when they brought the drip, I said, don't you have an infusion pump, a machine that could accurately regulate how much drug goes in? They said they don't have that, they do it manually. That was my first worry. So how are you going to give this thing accurately? So then, in between, they were disconnecting it and putting it back while she used the restroom. I was like, why not pass a catheter so that urine can flow through the bag and keep her there? So because each time you remove and put, you are altering the quantity of drug you should give. At first, the doctor dismissed it. Then later, he said, he bought into the idea. So he said I should excuse them. So I excused them. They passed the catheter. Then she was having one line. Again, I told them, it's one line. One line is risky. Emergency can come up anytime. Why not put a second line? They said, okay, I should put it. So on putting the line, I noticed that our veins were collapsed. I was not wondering, this is not how my wife vein used to be when you put the tourniquet.
Did you raise an alarm at that time?
No, I didn't. Then she was fully conscious. She was. And I felt the team knew what they were doing because they were just smiling. They were just doing as if they understood what was going on. Just at around 2:10, she just said she wants to sleep. She wants to sleep. She just fell back on the bed. So meaning, if they didn't pass that catheter, she would have.
2:10 in the morning.
Yeah, 2:10 in the morning. So that means, assuming they didn't pass that catheter, she would have collapsed in the bedroom. That's where the collapse would have happened. So that's how she fell on the bed. She wants to sleep. She wants to sleep. But before then, like 40 minutes before then, she started having contractions with the oxytocin. She was in severe pain. She was trying to come down off the bed, trying to go. But all of a sudden, the pain stopped. The pain stopped. Then she was unconscious. She was not just unconscious. She was gasping for air. Yeah. It was a critical. It was a critical. This is an unconscious patient in labor. And before now, the examination they did, she was just 6 cm. Because when you get to 10 cm, they ask you to push. So the baby has already left the womb and was stuck in the vagina. I was like, oh my God, what's this? I'm losing my baby. I'm losing my wife. At the same time, she was gasping. She couldn't breathe. She was foaming. The lips were already getting like blue. The midwife was panicking. The junior doctor was panicking.
And the other doctor was nowhere to be found.
No senior consultant, no consultant on ground, no pediatrician, no intensivist, no O&G doctor on ground. And I was trained in the intensive care, and so I couldn't just see her die. So I had to just support them. So I said, okay, get an ambo bag, connect it to our oxygen. Let me just put it over her face. Because when they check the vital signs, I told them to check vital signs, behold, our blood pressure was 60/40, extremely low. The heart rate has gone up. Oxygen saturation has dropped. So it means that probably she has been bleeding from that first time she complained in the night. So that's how they were just panicking. Okay, the midwife said they should stop the oxytocin drip. They stopped it. So they made an attempt to take her to the delivery suite to see if they can.
So didn't anybody call the consultant doing all this back and forth? Did anybody call the consultant?
Yes, they started calling the consultant. Guess what? The consultant was in another branch, running an outpatient clinic. You could imagine. So he was choosing between who he will attend to. So that was how 50 minutes gone, 1 hour gone, up to 2 hours. We were in panic. In panic. We're just trying to say, oh, so how do we do it? We're just confused. No intensivist to, not that she needed urgent, just she needed urgent. She needed somebody to be resuscitating. Because she was not breathing well. She was just gasping. She was dying. Okay, the consultant finally came, by God's grace.
By what time?
That was around 12.
Midnight.
Before 12 in the afternoon. Yeah, she collapsed at 10 a.m. So he came at 12 p.m. So when he came alone. So who would do anesthesia? You've had a distress call that a patient in labor was dying. You came alone. He had to beg me to help to anesthetize my wife. There was nobody. So at 12, so should we still wait for the anesthetist to come for a patient that was actively bleeding? So I had no choice than to, so what should I do? Yeah, I had to start up the anesthesia for him to go in. When he opened, the theater was not ready. Nothing was ready. They were just panicking. It's still the midwife that didn't know what she was doing. That was the scrub
A private
nurse.
hospital?
Yes, a private hospital. It's still the midwife. They were not perioperative nurses. There were no A&E nurses. It's still the junior doctor that was assisting the consultant when he came. I thought he would have come with a colleague of his. Seeing how serious the issue was, there was no blood pressure. We were struggling. We were just... So when he started the surgery, that was probably about after 12. if you see the blood that came out, see how you know that there's no oxygen in this woman's body. Before it even came, she has already suffered brain injury. The eyes were already deviated. She was already having something, as if she was having seizures. Then the baby was already dead.
Oh.
So he had to bring the baby from the birth canal. So, but because the baby has forced himself, and it was a big baby. The baby came out 4.2, and the scan was 3.8. So because he brought, so she has already had tear all the way to the vagina. So apart from that, he was struggling to repair the bleeding vessels. Because even before now, I've told them this is ruptured uterus, because the way she presented, the womb has busted because of excessive use of the medications that they were not obviously controlling
let
well.
me pause you for a second, because I know, again, this is a very difficult conversation to have, because we're all mothers here, and especially Nima. Nima can almost relate to what you're saying, because it is not an easy conversation to have. We've been through this phase where we're in the hospital, trying in labor, and understand this back and forth. What do you think went wrong exactly? The issue, and what do you think the hospital, what do you want? What kind of justice are we looking for today?
So first of all, what went wrong was adequate monitoring. You were supposed to monitor for early sign of complication, which they had no idea. In fact, they claimed they were not aware she was bleeding. So before the anesthetist came, it was 3 hours. Baby has already come out. Can you imagine? Baby came out. The consultant was begging me to leave my wife to go and resuscitate the child because there was no pediatrician around. Again, I had to leave them in the theater, go to my baby. When I got there, I saw some nurses. They were just looking at the baby. Nobody knew how to do CPR for a baby. I had to start all over again to resuscitate. After 10 minutes, when I realized that the baby was dead, I had to go back to my wife. When I went back, see the whole floor, blood everywhere. I was like, what are you doing? Do this thing fast. This patient, so he said he's going to remove the womb. That was his last means to save her. I said, okay, remove if you want to remove the uterus, because my wife should be alive. I've lost the baby already. I shouldn't lose my wife. So we're just struggling. So one year, an anesthetist came. I had to beg him to intubate, that is, put a breathing tube and connect. But the machine was not even working. The ventilator, whether I could not know how to use it or it wasn't working. Then in between, lights were just going up and down, up, off and on. At a point, we were even using touch to assist the surgeon before they could restore the light. So medically, they were not prepared for her. Surgically, they were not prepared for her. So that was how she bled. They were trying to see how the uterus could contract and stop bleeding, because the uterus couldn't contract. They had to take it off. It was just the flow of blood. It couldn't stop. She was bleeding from the vagina. She was bleeding from the uterus. So it couldn't secure the bleeding. But this hospital is notorious for
that was where I was going to go.
They are notorious for now they are trying to exempt themselves. Imagine the cheap excuse that, oh, she refused the blood transfusion. Today on the papers, they will come and say she did not take blood. Tomorrow, they will say the husband did not allow them to give enough. So you can imagine. So when you keep...
We've had the conversations like this.
Can we first know the name of this hospital?
Oh, we've had a conversation on this same hospital, on this same show, barely 4 years ago.
Imagine.
On a murder, on a case of somebody dying.
Imagine. They are reckless.
Let me go on a break for a short so that we can take everything in. When we come back, we'll take a few questions. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.